Well, a pilot program in Queensland is aiming to improve the health of mine workers, and if it works, it could be used in other states as well. Bureau of Statistics figures show that 3/4 of mine workers are overweight or obese, putting them at risk of developing type 2 diabetes. But a pilot program being used at the new Hope mine near Ipswich hopes to change that and coincides with Queensland Diabetes Week, as Emma Pollard reports.
It's the fastest growing non-infection disease globally.
Going blind, losing limbs, ulcerated sores, kidney problems, all heart attack, all of that is good stuff.
Type 2 diabetes is shaping up as the health challenge of the 21st century. Each day, about 275 Australians are diagnosed with the disease, and the numbers are growing.
We need to turn diabetes around now, and we need to stop this epidemic. What's going to happen is we're going to have an increase in heart disease, kidney disease, amputations, glaucoma, all those sorts of issues.
At National Diabetes Week events like this one, the warning signs are being tested.
Do you know if your family has diabetes?
My father was diabetic, and my mother is she's also diabetic.
Okay. Now I have to measure your waist measurement.
Waist measurements can indicate whether further tests are needed.
2.5 hours of physical activity per week, so 30 minutes a day.
Not quite. I do it maybe 3 times a week.
One person staring down the disease is John Rogers. The 56-year-old mine worker says long hours and a poor diet have taken their toll.
Bit in denial. And then just before my first grandchild was born, I decided I should do the right thing and watch her grow up. So I gave away the smokes and lost a fair amount of weight and started cycling and exercising and doing the right thing.
Diabetes Australia is targeting other mine workers this week. Bureau of Statistics figures show 3/4 of mining industry workers are overweight or obese.
Copy. Bike in position, all clear.
It's a ticking time bomb for type 2 diabetes. The new Hope coal mine is a round-the-clock hive of activity. These workers do 12-hour shifts with 2 30-minute meal breaks.
Well, you're pretty tired when you get home, so preparing, meals and that's a bit dodgy.
This mine is taking part in a diabetes pilot project which could be rolled out nationally.
It's the tape measures around the waist and to tell you whether you're in the risk, and everyone's have a go at it and talking about it. So it just gets people talking about it, and it's really good.
Brent Milligan has heeded the warnings.
So I've lost 21 kilos in about 3 months now.
If you think you're a bit chubby and you do have having a sedentary lifestyle of lots of drinking and lots of eating and no exercise, then sooner or later you're going to get it.
I think it's a real investment in your current workforce. If you keep them healthy, they'll stay with you a longer time, and you'll have healthier workers in the future.
Emma Pollard reporting.